mission of the Fox Chase Cancer Center is to reduce the burden of cancer in our society. We do that not only through the treatment of established cancer, but also importantly through the prevention of disease, the early detection of disease, and hopefully, for survivors of cancer, long-term palliation and follow-up. Fox Chase is a broad-based, freestanding cancer center. We take care of nearly every kind of cancer. I think we have a particular expertise in gastrointestinal cancers, in genitourinary cancers, and in ovarian cancer. The particular programs that we're known for in the gastroenterology division, I think, focus on cancer prevention and cancer control.
Translational medicine can be defined as basic science that can be translated to clinical care of patients. This is a major goal of a comprehensive cancer center like Fox Chase. The one that we're focusing on particular here is identifying patients who are at high risk of cancer so that we can intervene early in the disease.
The high-risk colon cancer clinic at Fox Chase Cancer Center is a multidisciplinary clinic that has actually both clinical features and research features. The major clinical components of the program are to offer patients genetic counseling, assessment of familial risks. We, as a group, meet, review clinical records of patients, and determine whether genetic testing for hereditary cancer risk may be a good approach to help understand the risk in the family. We both offer pre-test and post-test counseling. Some of the research we do is genetic-based or epidemiology-based. We collect data on a large number of patients with hereditary colon cancer, and through local and national, even international consortiums, we're able to pool those specimens together and that data together to try to better understand some of the subtleties related to hereditary cancer risks.
We're trying to better predict who will develop colon cancer. So we've hypothesized that we may be able to identify those patients at risk from blood tests that study the behavior of their normal cells, their normal white blood cells. We've hypothesized that these cells from individuals at increased risk may show increased genomic instability. And we have evidence that the patients from these colon cancer prone families show increased evidence of genomic instability.
One of the strengths of our gastroenterology program at Fox Chase is interventional endoscopy. We are one of the first sites in the United States to have access to double balloon enteroscopy, and over the years we've performed more than nearly any other site in the U.S.
The interventional endoscopy group at Fox Chase Cancer Center is made up of 2 faculty physicians with over 25 years of experience doing advanced endoscopic procedures. Patients that get sent to us tend to be very complicated patients with complex endoscopic needs. We do things like complex polypectomies. We also do a lot of pancreatic and biliary endoscopy. We also see patients with early stage neoplasms throughout the GI tract. For example, patients with Barrett's esophagus who have either high-grade dysplasia or early-stage cancers. And in the past, many of those patients would have required an esophagectomy, which means surgical removal of the esophagus, which has a lot of morbidity and a lot of mortality associated with it. Since we've built the interventional endoscopy program at Fox Chase, many of those patients no longer need such aggressive care or aggressive surgery, because we can usually treat them endoscopically.
I think the practice that we have here is unique in that we are able to focus our efforts very intensively on the endoscopic procedures and the endoscopic care of these patients with gastrointestinal tumors, which endoscopic practices in more generalized hospital settings often cannot accomplish. With the advent of endoscopic ultrasound, we are able to accurately diagnose and stage patients with tumors, and this has a critical role to play in terms of optimizing the best treatment plan for our patients.
In my work, the way I can reduce risk of cancer or prevent them is treatment of chronic viral hepatitis. As you know, that hepatitis B and C are the leading cause of liver cancer. So to identify those patients and treat them could prevent them from having liver cancer at all. Fox Chase is well known in viral hepatitis B because Dr. Baruch Blumberg, the discoverer for the hepatitis, the virus, has worked here since the 1960s. He received the Nobel Prize for medicine in 1976 because of his discovery. We also have Dr. Thomas London, who worked with him on the hepatitis B vaccine, which have saved millions of lives around the world, especially in terms of liver cancer and chronic liver disease.
Fox Chase is justifiably proud of its long history of research prominence. Work here has been seminal in the identification of the Philadelphia chromosome, the SCID mouse, essentially everything we know about hepatitis B and its vaccination. It's a long list.
When I started out in medical school, women presence in medicine is much lower than today, especially in the field of gastroenterology. At Fox Chase, I got great support from my mentors and colleagues, and my journey as a woman gastroenterologist has been very easy.
I think we have a unique gastroenterology division in that we practice at the interface between cancer and gastroenterology. And while other groups do that, our expertise, I think, in this area has few rivals. This is what we do every day. That expertise makes us unique and certainly will put us in good stead going forward.